thyroid is subpar, even though it's within normal.
Okay. It's just, all right.
You're subpar thyroid functioning. We have body signals.
Okay. Okay. All right. What are the signals?
Cold hands and cold feet, number one. Wake up in the morning headache. Constipation. Not to be silly, but constipation. Thin hair. Thinning of the eyebrows. Fatigue.
Really?
High cholesterol. All body signals of a low thyroid gland.
Okay. All right. So, if you have those symptoms,
Those body signals.
what do you recommend that we do?
I would suggest that you should have those thyroid tests, TSH, T3, and T4.
And a doctor can do that if you
Okay,
ask
but-
them specifically, but they won't unless you ask
You
them.
have to ask them, you can put a little pressure. I'm telling you, you read Dr. Bob's book
Okay.
on female hormones, which always opens up a lot of doors, by the way. And today, we actually have the ability that we can check, without being really silly, your urine iodine. With a dipstick, you catch some, you have urine go on the stick, and we send it to a lab, and they'll tell us your iodine level, the lab will. If you don't have enough iodine, you're going to have an issue. But the real problem, Robin, are iodine antagonists. Chlorine, bromine, and fluorine. Which, watched the newspaper last week, they're reducing the amount of fluorine in the water. I don't know if you caught that or not. There's too much.
What is fluorine? Is that fluoride?
Fluoride, chlorine,
Okay.
it's easy to say chlorine, fluorine, and bromine. It's what we call a halide. The halide's in the periodic chart. Halides are antagonistic to iodine. So what I have here is a shower dechlorinator. So this morning you were in a room, 4x4 glass, you were breathing in toxic gas, chlorine, which is antagonistic to the thyroid gland. That's the shower dechlorinator.
Let me ask you this: has a study ever been done on swimmers then?
Well, I have done studies on swimmers in our own practice, and they come in with white, gray hair, and they're 35 years old. We will check their thyroid gland out. Almost inevitably, they'll always have low thyroid body signals. A simple test to do at home is with a thermometer. This is the mechanical thermometer. You shake it down before you go to bed at night. You put it in your armpit when you first wake up in the morning. The
Don't
temp.
sleep with it.
No, you don't have to. You could put it somewhere else. Right here in your armpit. 97.8 the temperature should be. If it's less than 97.8, it's a body signal. You can have the potential of a low thyroid.
Okay. All right.
Dishwashing detergent. This has chlorine. This does not. Have you ever breathed the steam coming out?
Oh yeah.
So it's antagonistic to your thyroid gland, and this happens to be the iodine I take. I take 12 milligrams of iodine every day. If you are thinking about taking iodine, you should always go slow, because if you have bromine, fluorine, and chlorine in your body, so you might start with 6 milligrams a day. You could have a rash, a headache, metal taste in your mouth, because your body's getting rid of the bromine, fluorine, and chlorine. This is very serious, by the way.
So this gets rid of this, but if you get rid of this in your environment, you don't need to take that?
Well, if we live in the border belt here in northern Ohio, most people in this area who aren't exposed to any kind of ocean food, if you eat seafood, if you eat sea vegetables, 12 milligrams a day is what the average Japanese person takes. Larger people need more iodine. Ladies with larger breasts need more iodine, because iodine is for your thyroid, breast, ovaries, and testicles in men. Well, this is,
Covered it all in
this,
that one.
this is the Dr. Bob Get Serious. This is